Liver-related dysfunction occurs when infected hepatocytes are destroyed in large numbers during acute viral hepatitis. There is a wide range of liver-related dysfunction, such as effects on bile production, coagulation, blood glucose, and protein metabolism. Some other things that are affected include changes in detoxification and processing of drugs, hormones, and metabolites. If hepatitis is resolved, liver cells can regenerate and resume their normal function and appearance. But if hepatitis becomes severe and is untreated, it can become irreversible, which can lead to liver failure or death. People who are at higher risk of contracting acute hepatitis include people who live in areas of poor sanitation, live in areas with contaminated water, injection drug users due to needle sharing, and anyone who comes into contact with bodily fluids, such as semen, blood, and vaginal secretions.
Diagnostic testing includes an acute viral hepatitis serology panel. Testing will detect the presence of inflammation due to one of the three most common hepatitis viruses. The test is performed utilizing a blood sample from the patient, with each finding produced with specific etiology. Aspartate aminotransferase, which we know as AST, and alanine aminotransferase, which we know as ALT, will appear elevated in the acute phase, but decreases as jaundice disappears. And this result is produced because of injury to the liver cells. Liver cell injury is also to blame for an increase in gamma-glutamyl transpeptidase, which we know as GGT, and also for the serum bilirubin increase. The serum bilirubin will we'll see an increase to somewhere between 8 to 15 milligrams per deciliter. We'll also see that the serum albumin may produce a normal to a decreased result. And when I say decreased, I mean the within range. When we have the within normal range numbers, we see either an increase or a decrease in those numbers. Alkaline phosphatase will produce a moderately increased result, and this is because of impaired excretory liver function. Impaired liver clearance causes serum protein gamma globulin to appear normal to increased. Urinary bilirubin is found to be elevated, and this is because of conjugated hyperbilirubinemia. And urinary urobilinogen increases 2 to 5 days before jaundice begins, and this is because diminished absorption of urobilinogen. And finally, there is often a prolonged prothrombin time, and this is because of decreased prothrombin production by the liver. The FibroScan is a specialized ultrasound machine made just for the liver. It's going to measure fibrosis, which is scarring, and steatosis, which is fatty change within the liver. Fatty change is when fat builds up within the liver cells, and this occurs in liver disease or when there's damage done to the liver. A probe is placed outside of the body where lateral lung sounds would be heard at the area of the liver, and it kind of vibrates, and these vibrations send back a result, and that lets the healthcare provider know how much fatty change or scarring has occurred on the liver, to the liver rather, based off these vibrations. And the numbers produce a CAP score, which measures the fatty change within the liver, and if it's 238 to 260 is considered an S1, which means that there's 11% to 33% of the liver is found to have fatty change. If you're between 261 to 290, that's considered an S2 grade, and there is 34% to 66% fatty change. And if you're higher than 290, that puts you at a S3 grade, which is indicative of 60% or 67% or more of the liver having fatty change. It also measures, like I said, the scarring of the liver. This result is measured a little different. It produces a 2 to 7 kilopascal result. If you receive a fibrosis score of 0 to 1, that means there is no liver scarring or very mild liver scarring. An F2 result is a moderate liver scarring result, F3 severe, and F4 advanced liver scarring or cirrhosis.
Common medications. Acute hepatitis has no actual drug treatment, but does have supported drug therapy that includes antihistamines for generalized itching and antiemetics for nausea. With the different types of hepatitis, the hepatitis B infection will need treatment if there is a liver failure or severe hepatitis. With hepatitis C, the patient can be monitored for spontaneous clearance of the infection, and hepatitis A has no drug treatment. Treatments. There is no specific treatment for acute hepatitis. Emphasis is on providing the patient with adequate nutrition and measures to rest the body and assist the liver to regenerate and repair. Well-balanced diet, vitamin supplements, particularly the B complex and vitamin K. Rest helps assist to regenerate and repair the liver. Avoidance of alcohol intake and drugs to help detoxify the liver.
There are several nursing diagnoses appropriate for acute hepatitis, and they include activity intolerance related to weakness or fatigue caused by infection, deficit diversional activity related to isolation, risk for deficit fluid volume, the risk factor being excessive loss of fluids from vomiting and diarrhea, and readiness for enhanced knowledge. This is an expressed interest in learning about the condition from the patient. And then there are the three that we chose to focus on: imbalanced nutrition, less than body requirements related to altered absorption, altered metabolism, and biostasis, acute pain related to inflammation, edema of the liver, and the irritation of the skin from bile, and then fatigue related to infectious process and altered body chemistry. For imbalanced nutrition, we're going to want to weigh our patient daily. This allows us to establish a baseline and quickly identify a decline in condition and malnutrition. We're going to monitor I's and O's, and we are going to want to offer the patient snacks or make sure at least that they have access to snacks between meal times. We're going to want to offer the patient give the patient options or offer high protein foods, since patients with acute hepatitis require healing. We're going to want to offer high protein foods that promote healing. We're also going to want to make sure to administer analgesics and antiemetics around the clock as prescribed. This helps increase the likelihood that our patient will want to eat. Any presence of nausea or pain are going to decrease the patient's appetite. For acute pain, we're going to want to establish a baseline pain score using a 0 to 10 numerical pain scale. We are going to also want to establish what an acceptable level of pain is for the patient. We may not be able to completely eliminate pain, but we want to establish a numerical number that is going to be acceptable and comfortable for the patient. We're going to want to make sure that we use both pharmaceutical and non-pharmacological interventions, administering pain medications as they're prescribed around the clock. We'd rather not have to catch up to the pain, and we can use interventions in between administering pain medications to manage the pain, like cold hot packs, massage therapy, and guided imagery. We're going to also want to reassess pain levels after using these interventions to evaluate their effectiveness. And finally, for fatigue, we're going to want to make sure that we keep our patients hydrated, as dehydration has been shown to cause fatigue, and patients with acute hepatitis may have nutritional imbalances. We're going to also want to encourage our client to express feelings, as depression related to the health condition can dramatically decrease the patient's overall sense of happiness and increase the amount of fatigue that the patient experiences. And finally, we're going to want to teach the client to conserve energy, like sitting when they can, storing items at waist level, and exercising only to their tolerating level.
Acute hepatitis clinical manifestations. Many patients with acute hepatitis might have symptoms that go unnoticed or simply do not have any symptoms for a long time. As a result, it often takes a long time for hepatitis infection to be detected at all. These symptoms, such as general malaise, weight loss, diarrhea or constipation, intermittent or ongoing anorexia, nausea and vomiting, abdominal discomfort in the right upper quadrant caused by liver inflammation, low-grade fever, fatigue, other flu-like symptoms, skin rashes, jaundice, and pruritus might be intermittent and ongoing. A patient in the acute phase of hepatitis might present or might not present jaundice. If jaundice is present, the urine color may darken due to the increase of excess bilirubin being excreted by the kidneys. If conjugated bilirubin cannot pass into the intestines from the liver because of obstruction or inflammation of the bile ducts, the stools will be light or clay-colored. Pruritus might also accompany jaundice because of the excess bile salts that is accumulating beneath the skin. Pruritus might be intolerable to the patient. This acute phase varies depending on the type of hepatitis, often lasts from 1 to 6 months. During this time, the patient might have decreased sense of smell and find food distasteful, and smokers might have a displeasure for cigarettes. Physical examination often reveals hepatomegaly, lymphadenopathy, abdominal tenderness, and sometimes splenomegaly. The acute phase is a period of maximal infectivity.
Acute hepatitis can be the beginning of a cascade of issues throughout the body. Some of the potential complications related to acute hepatitis are acute liver failure, chronic hepatitis, cirrhosis of the liver, portal hypertension, and hepatocellular carcinoma. Manifestations of these progressive illnesses are not limited to a set of signs and symptoms particular to each. There is a range of things that they all have in common, such as gastrointestinal bleeding, problems with blood function and circulation, swollen liver, a general feeling of malaise or agitation, problems in brain and neurologic function, fever, and increased white blood cell count is possible with acute liver failure. Hypotension and respiratory issues may also manifest as the potential complications progress. Acute hepatitis may also cause enlargement of the spleen, complications relating to acute or chronic pancreatitis, which will cause problems with digestion and absorption of nutrients. The renal system may also become affected, showing signs of oliguria and azotemia. Acute hepatitis may cause problems in the circulatory system, such as a problem with coagulation, increase in white blood cell count, varices in the esophagus and stomach, hypertension in the portal vein, and cause systemic hypotension because of lack of plasma proteins that are made in the liver. This can also lead to edema in the lower extremities and ascites in the abdomen. Aside from the manifestations mentioned in the earlier slides, hepatic encephalopathy is also a very serious manifestation that is caused when there is an increase in ammonia levels in the blood. The brain becomes affected and brain function and cognition of the patient are impaired. A patient with hepatic problems can also become jaundiced, which will cause an increase in bilirubin in the blood, and the patient will appear yellowish on the skin and in the sclera of the eyes and mucous membrane.